Welcome to AR News. Ambulance staff and nurses to strike on same day. Ambulances workers are to join nurses in taking strike action on 6th February in England and Wales in what will be the biggest NHS walkout in this dispute. The GMB announced 4 new stoppages for ambulance staff, one of which concluded with a nurse strike date. It is the first time both ambulance staff and the Royal College of Nursing (RCN) have attacked on the same day. It comes as RCN members are taking part in 2 days of the strike on Wednesday and Thursday this week. GMB National Secretary Rachel Harrison said ambulances workers are angry. Our message to the government is clear. Talk pay now. The walkouts by staff including paramedic, calls handlers and support workers in 7 of 10 English ambulances services along with the National Wales service will take place on 6th and 20 February and 6th and 20 March. On Monday, the RCN set 6th and 7th February as the dates for its biggest strike to date, involving more than 30 of services in England and all but one health board in Wales. Under trade union law, both union will have to provide emergency cover, but it raises the prospect of urgent 999 call for fall not being responded to, a huge chunk of pre-planned hospital care such as hernia repair, hip replacement or outpatient clinic not being done. To call to get around the negotiation table was ensured by ASEAN General Secretary Pat Cullen as her member walked out on Wednesday for third time this winter. We have extended an olive branch, in fact, the whole street to government. We have sent meet us halfway, so now come on. Hospital bosses have not been vocal during this dispute so far and access to hospital has been very limited. But one of the London's largest hospital opened the doors to us to show us the effect of strikes. At University College Hospital in London, a specialist surgical center usually sees 20 or more operations carried out each day for orthopedic and ears, nose and throat cases. But the operating theatres on strike days are empty and silent. The Royal College of Nursing has agreed that emergency care will not be affected, but across the trust, 2/3 of non-urgent operations have been cancelled and about 1 in 5 outpatients appointments. More than 2,000 patients are missing out on planned procedures or appointments. David Probert, Chief Executive of University College London Hospital Trust, has appealed to union and ministers to resolve a dispute which he says is hugely disruptive. He says settling the payroll is about motivating and retaining staff as well as avoiding cancellation for patients. My message to Mr. Probert said, and that are many chief executives around the country, is that this needs a resolution. We cannot continue to go through periods of industrial action and the disruption it causes to our patients and staff. Both unions have asked for above inflation rises, but the government in England and Wales have given NHS staff an average of 4.75%, with everyone guaranteed at least £1,400 as recommended by the independent NHS pay review body. That is less than half the rate of inflation. Although latest figures show the rates at which prices are rising has started to slow. Meanwhile, patients are being warned to expert widespread disruption to services on Wednesday and Thursday because of the RCN walkouts. 1 out of every 4 hospitals and community services are affected by the strike from 8 to 20 GMT, but GP practices will run as normal as because nurses working in those services are not involved in the strike actions. Saffron Cordery of NHS providers, which represented NHS services, said the scale of the walkout and the fact was over 2 consecutive days meant it would probably have great impact. We are expecting widespread disruption. She said it will be felt on the day as well in the days that follows. Thank you.